Pharmacology was one of the easiest classes for us in nursing school.
And if you don't believe us, look at this.
Boop. Hey, look, you see the transcript, you see the big B in that bad boy, and in today's video, we're going to give you our top 3 tips that helped us be our way out of pharm. Baby, is thing ready?
I don't know. Let's see.
Let's see. Tip number 1. The first thing that you want to know about pharmacology is to never try to memorize every medication one by one.
That's a big X.
That's a big X, and you're going to take a big L, all right? So what you want to do is group everything up by class, a.k.a. memorize the suffix.
Yes.
Now, baby, what do I mean by that? Please explain it to him.
So, metoprolol.
Huh?
LOL.
What?
Everything beta blockers end in LOL.
That's a fact.
So we have our metoprolols. We have our...
labetalol. Hey, any law. See, you're not going to memorize each one by one.
Yes, but you'll remember the laws. And you always remember LOL.
Yes.
So we have our prills,
Yes.
like our...
You have your lisinopril.
We have our
Captopril. Any prill, you know that it's an ACE inhibitor, all right? Your Artins, your ARBs for your heart.
Losartan.
In a Losartan, it's going to end in Artin, all right? So it's pretty much impossible to memorize each and every drug, but if you could group them in a class and look at those similarities and the suffixes, I promise you they will never trick you on the exam. No cap, am I right? All right? Baby, tip number 2, talk to them.
Number 2, y'all. So whenever you're learning about medications, you're going to go through so many signs and symptoms.
Lord.
Every medication causes nausea. Every medication
vomiting,
causes vomiting. GI
stomach ache. Of course.
Kidney failure.
Of course, they all do.
But whenever you're learning about meds, lock in on the most outlandish, weirdest sign and symptom that you're like, oh, that's kind of weird. I'm going to remember that.
So what's an example of that, baby?
Like, for an example, rifampin.
What?
It causes secretions to turn orange.
Ugh, that's weird.
Tears, urine.
Everything,
all of that
saliva.
turns orange.
That's weird.
That's weird. That's not normal. Not every medication does that. That's weird.
That's a fact. What's another one?
Vancomycin causes red man syndrome.
Red man syndrome.
Red man walking down the street. He probably has some veins.
If your patient turns this color, that's a problem, okay?
That's some bank right there. That's outlandish. That's weird.
That's a fact.
Right?
That's a fact.
Last but not least, like penicillin.
Penicillin.
It can cause a black, hairy tongue.
Black, hairy tongue.
Metronidazole, metallic taste.
You see this?
Tastes like metal in your mouth.
Like metal,
all
right?
Chewing on a coin. Those are weird. Those
Are
are
you?
weird. I love you. Those are weird symptoms. Those are symptoms that are not normal. And so lock in on those, hone in on those symptoms that are just weird.
That are weird. Nothing common, but those weird symptoms, I promise you, they're going to test you over there, all right?
Yes.
Tip number 3, last but not least, when it comes to pharmacology, you absolutely need to know antidotes, all right? Every single test that we took, 2 to 5 questions were about antidotes, all right? So the most common ones you will see will be your warfarin. So if somebody is on warfarin, they're bleeding out. Oh my God, what do you give them, baby? What do we give them?
We will give them vitamin K.
Boom, vitamin K. You have to know that. If somebody's ODing off of opioids, baby, what do we give?
We're going to give them Narcan.
Naloxone. All right, baby. Last one. If somebody's on a benzo, they tripping, they can't get up. They can't get up. Do I give them Narcan? Will Narcan work for benzo?
No, it will not work. We got to give Flumazanil.
All right. So look, this is going to come with time. But please, really lock in on your teacher when they say, for this medication, give that, because 10 times out of 10, they will absolutely ask you what the antidote is.
And a bonus one.
Oh.
If they have heparin, what should we give them for an antidote?
I have no idea, Jada. Can you tell the people?
Protamine sulfate.
Oh, my God. Hey, what's funny is I really ain't know. So it's protamine sulfate. Don't be like Tyreek. Know the antidotes for everything. So look, if you enjoyed those tips, those were our top 3 tips and a bonus on how to pass pharmacology. Look, if there's any other questions that you need from us, if you want to know how to pass OB, if you want to know what we did to pass anything, comment right there. Make sure you like the video, share, and until next time, man, we gone. Peace.